Hi, everybody. Dr. Tassone, take two, Essure question and answer period. I figured we would go ahead and try this again. Hopefully a bunch of you come on today and ask some more great questions. The last time we had like 300 questions. We had a lot of people answering, and I cut it off at about an hour because we were running a little over. So I wanted to do this again and see if we had anybody deciding to chime in today. So I'm going to stick around, and if I don't get any questions, I'm going to just probably talk a little bit about what I'm seeing and what I think is going on right now. And what we can do is talk about what I think is going to be the biggest problem in the next year or two, is that more and more of you are getting Essure removed. And as you get Essure removed, you're going to notice that it's going to be done in different ways. And I basically wanting to do this to make sure that you all get the Essure removed in the correct way. It's currently recommended in the instruction manual that you can have what's called a salpingotomy, which is where the surgeon will make an incision in the tube and then pull the coil out, which I do not recommend simply because they can break and they're not the most sturdy devices. And I fear if they're scarred in good and you pull on them, they can break and you can leave fragments. The second thing that is being done is what's called a salpingectomy. Now, a simple salpingectomy involves just removing the tube from the uterus. And that can be fraught with error too, because if you have a grade 2 insertion where the Essure is supposed to be where it's supposed to be, and you cut the tube literally right at the junction to the, sorry, I got my fingers messed up. At the junction to the uterus, you're leaving the piece of the coil that is still inside the uterus. And so you could be fraught with fragments. You could have PET fibers left behind. Unfortunately, the PET fibers, we have no way of really telling if they're behind or not. But what I would recommend, and I think that some of the other surgeons in the group, Sills and Jerome, would recommend that you have a salpingectomy, but with a partial cornuectomy. And the Tassone method that I've come up with is what I call a coring salpingectomy. I believe Dr. Jerome in Atlanta calls it a salpingectomy en bloc. I wanted to also let y'all know that I am devising a course for your physician to learn how to do this procedure, and not just learn how to do the procedure, but I also include all the materials that I've collected over the last 3 years on how to work the patient up, how to do it from out of state, out of town, how to schedule the surgery, how to use the codes to get it coded for by the insurance company and get it paid for, and then how to post-op, even post-op from a distance over the Medici app, which I don't charge for. So it's a way to connect with you as a patient, even if you're out of town. So if you all have any questions, I'd like to hear from you. Trying to type and see if it shows up on the screen. Questions? Anybody have any questions for me? I'll take them as they come, and we'll see if we have anybody that's got anything going on. I'm going to also ask that you guys share this as much as you can. If you're over on the main Essure Problems page, I would really appreciate it if you could share it with your page, your local subgroup page. That would be great. And if you all want to come to my website, I'll link you to that. If you look up Essure Problems Tassone Method, I have a website over there that will also show you what's going on. So can somebody tell me, I'm going to show this. Whitney says her screen is frozen. Is anybody else frozen? Or is it, let me check my phone and see what's going on. I'm not seeing that it's frozen here. And I'm not seeing that it's frozen on my phone. Okay. Christine, welcome. Thank you for asking the question. Can you speak on the importance of not cutting and pulling the coils? I'm seeing this happen still. Christine, you're going to see it happen, and you're going to see it happen a lot as we move forward with this, because so many women are wanting to have these removed, and rightfully so if they're having symptoms. But here's my point. Cutting, because here's what I'm seeing now is I'm starting to see a lot of women that are having problems with the coils being removed, whether it's by hysterectomy, they're being cut through, they're being salpingectomy or salpingostomy, and they're being left with fragments. And I had a lady about a month or two ago that actually had the fragments sewn into the top of her vaginal cuff, and I had to resect a piece of the vagina to remove it. And if these are removed right the first time, I tend to see that women have more pain resolution and better results than if they're left behind. I think fragments are the worst thing you could possibly have after having a removal. And if they're cut, you're potentially left with fragments. And if they're pulled and they break, who knows what's going to happen. So anybody else have any questions? Hey, look, I can put up hearts. I can change my screen. It's Valentine's Day. I thought that was funny. If you have any questions, fire away. Also, with this course that I'm going to be teaching to the physicians, I'm going to have a website where patients can go and type in their zip code and see if there's a doctor that has been through the course, so you know if they know the proper way to remove. I think that's going to be great. It's going to be helpful. And because I get 10 to 20 requests a day, and I've been asking y'all to send me doctor email addresses, and I'm trying to see if I can get doctors to, I'm going to put my email up here and see if I can get my email up to you guys. It's not working. Sorry. There you go. Triana. With LAVH, how common is this issue of cutting or pulling? If they're doing an LAVH and they're keeping the tubes attached to the uterus, so if they're doing the LVH and they're actually removing the tubes at the same time, then they probably won't be cutting the tubes, and that wouldn't be an issue. If they're doing the LAVH but they're leaving your tubes behind, which I unfortunately have seen done, then there's a high risk that they're going to leave the fragments. So with the LAVH, you're going to want to make sure that they are removing the tubes at the same time. That would be the main thing that I would want to make sure of. What else? Other questions? What else am I seeing? Another big thing is proper evaluation prior to the surgery. A vaginal ultrasound or an abdominal ultrasound or a CAT scan, I'm just not real convinced that that's the best test. I think that undergoing a pelvic X-ray, just a simple pelvic X-ray, will tell you where in the pelvis they are. It won't tell you where they are with relations to the actual soft tissues of the muscle, but it will, of the uterus, but it will tell you if they're in the pelvis. And that's the main thing you want to know. I personally don't think that undergoing a hysterosalpingogram is worth the pain or worth the radiation exposure from the dye. Now, if you're doing a salpingectomy, that's a possibility and it might be worthwhile. And it's especially beneficial if you're having a reversal. But if you're having a removal, I don't think it's necessary. And if I'm worried about removing the tubes, then I will do the X-ray in the operating room. Whitney, when you do surgery, how do you remove everything in one piece vaginally? Do you core cut the pieces, literally come out in one piece? This is the problem, Whitney. If you have a straight vaginal hysterectomy, I don't think there's any way that you can keep the coils intact, because there's no way to remove the tubes still attached to the uterus when you do a straight vaginal hysterectomy. Now, if you have little Band-Aids on your belly where they did a laparoscopic assisted, then you probably have the tubes removed intact. But if it's a straight vaginal hysterectomy, then I would be very concerned that you had the coils cut through, or that you still have pieces of coil or tube still left inside your body. What else? Sorry, my 15-year-old is texting me, so I'm going to wait for you guys to give me a He's taking an Uber, and I want to make sure that he gets where he's going. So if you guys want to ask some more questions. So Whitney's having an LAVH. And so, right, with an LAVH, if they're also doing a bilateral self-injectomy, that usually means they're leaving the tubes attached. I would just make sure, if I were you, that you actually make sure and you say, look, I want these tubes attached. I don't want there to be any cutting of the tubes at all. And I'm sure that they can do that. Sorry, I'm going to text while I'm on here. Do you ever notice that having kids, you never really have any time to yourself, or that you don't have any money left? It's like gone. It magically disappears. That's just a joke. No, not really. So what other questions do you have? I'm still, if you have any questions about workup, post-op, complications, what I'm seeing, what I do for out-of-state people, what I do for in-state people, how I do my evaluations. Thank goodness Christine's here. Nobody would be asking me any questions. Is it your opinion, in your opinion, is it normal to have menopause symptoms post-surgery? Well, obviously, if you take the ovaries, that's going to be a problem. But I'm assuming the question is if you leave the ovaries intact. What I've been seeing, and I think what we can see, there's been some studies that show this, is you do have a little bit of disruption of the blood supply to the ovaries after the surgery, which can then cause decreases in hormonal fluctuation. I always check the hormones before the surgery, and it's probably a good idea for women that are having symptoms to just have their hormones checked after the surgery. Usually within that first 2 weeks is when it's more noticeable. So if you can usually get through those first 2 weeks without anything, chances are you'll probably stabilize later on and be okay. Is a CT scan an accurate way to say they're in place? I mean, a CT scan is definitely a great test. It will probably tell you where they are, but it's a ton of radiation that I don't think you need. And it tends to be an expensive test when compared to an X-ray, which is probably $45 versus, hundreds of dollars for a CAT scan. So I would just go with an X-ray over a CAT scan. How common is bleeding 3 weeks post-op, and should I be concerned? Well, because you've had the best surgeon around, Carrie, I'm going to say it's really normal. Now, actually, as the top of the vagina heals from the sutures that are in there, and the more that you get up and walk around, spotting, especially when you wipe, is fairly common and it's fairly normal, and you could see that for weeks, 4 to 6 weeks even. So I wouldn't get overly concerned about that. And I would just kind of take it easy and not push yourself too hard. My phone hasn't rang all day, and now my wife's calling me. My 15-year-old called me. It's like whenever you try to do something, right? Murphy's Law. Who else? Anybody else got any questions? I'm going to look at my son. He texted me back. Okay, so he got to practice, just an update. And then the second that he got to practice, the coach canceled practice. I mean, how do families that have jobs do this? It's crazy. I don't know. It's like the teachers invite us to like the kids' stuff like the day before. Like we have time to just go, I mean, it's like crazy. It's like, yeah, we'll go at 10 o'clock. And then you're that parent whose poor kid is there with no parents. So, so what else do we got? Any other questions? I'll sit here as long as we need to sit here. I think we're doing some good questions. We got 14 people live, and just remember, there's going to be the last video I did had thousands of views, and it was really well received. So not only are you asking questions for yourselves, but you're asking questions for others. Would I have to have an X-ray if I've already had a CT scan done? I personally like the X-ray, and I'll tell you why. Unless I have the full body image of your CAT scan, which is usually the first film that they take, and I can see it, then if it's within the last 6 months or so, then I'll use that CAT scan. But I like to see where the coils are and how they're positioned. So if you can get that, then I use that. So that's a good question, though. Because usually the first film they take is just a whole body shot of you, and you should be able to see the coils on that. What else? Trying to think of other things that I'm seeing. I'm still having trouble with my hormones. Am I ever going to be normal again? Well, yes. Well, first of all, what's normal? So don't think, and I don't mean that in a horrible way, but I mean, we all have different normals. If you don't feel normal, though, then call Amber tomorrow, 512-533-4141, and tell her that we talked and that you want to get your hormones checked. And what we'll do is we can send a hormone panel request to a lab wherever you live, and I can get those results and we can change your dose around. How do the coils migrate? I don't think we have the answer to that. And I don't know if we'll ever know the answer to that. So I think we're going to learn things as we go, but any sort of material in the body has the potential to migrate. I mean, we've been using surgical staples for a long time. They can move. The fill sheet clips can move. Unless it's cemented into place like a hip replacement or a knee replacement, I think there's always going to be the chance that they will migrate. Veronica, you're welcome. We'll get you fixed. Not that you're broken, but we'll get you feeling better for sure. And that's the other thing with these. I do hormone checks on everybody. And I do that because I've been finding that I might be able to help you feel better even before the surgery. And then most of y'all are able to come off the hormones, but occasionally you get people like Veronica who just don't feel right after the surgery. And doesn't matter what age you are, we can help balance that out. I can definitely help balance that out, get you feeling better and more normal. So that's not something that any of you that have had surgery in the past have to live with. So what other questions anybody got? We're going on about 20 minutes and I don't want to drag this on if we don't have any questions for people. So keep asking. If you've got a couple, I'll stay on for another minute or two and we'll figure it out. As my son has his practice canceled and he's sitting there pretending. Hey, Veronica, do you want me to show that question? I don't want to show it if you don't want me to. But the hormones will fix everything from sleep to hot flashes, vaginal dryness, decreased libido can get better, energy can get better. So a lot of things can change. And Veronica was asking because she's having vaginal dryness. And I think, the first thing I would recommend for vaginal dryness, Veronica, that's completely natural and easy to use, and I recommend it to a lot of people, is coconut oil. Just get that coconut oil. It's at room temperature. It looks kind of like lard. You can just rub it on the outside, and that might help immensely too. Coconut oil, it's great stuff. It's good for your skin. It's a healthy oil, and I would try that as well as getting your hormones balanced. Somebody, let's see. Yeah, I answered I answered your menopause question. Prolapse, Whitney. What about prolapse? Prolapse is common in many women, but surgery is just one aspect of potential prolapse. There's age, genetics, obesity, smoking. Do you do repetitive activities that cause bearing down or bouncing? That can add to prolapse. So surgery is one aspect for potential prolapse, but it's just one. And usually when people come in, I'll evaluate them for bladder prolapse. Some of y'all have had a bladder suspension that I've done. I don't use mesh unless you specifically ask about it. Oh, I didn't see your question about PET fibers. Christina asked about PET fibers. The PET fibers are on the inner coil, the hard, longer rod that you see, not the outer coil. And the PET fibers are actually microscopic. I think somebody on the main page has a picture of electron microscopy. And so when you try to pull that rod out, if you're just pulling and cutting, you are potentially leaving those fibers behind because it's like a shag carpet, and there's no way. That's why I like to leave them intact. Annabella, why are they implanting Essure for women who need assisted pregnancy? Not sure the name is right. Here in Italy, they're proposing. Okay, so what they're doing, Annabelle, what I think there have been some studies that using Essure to close tubes in women that have what's called a hydrosalpinx, meaning the tube is already blocked at the very end, and it makes it severely difficult for those women to get pregnant. So what they do is they put the Essure in to try and close those tubes, and I think that they have higher rates of successful pregnancy. That's probably a question that would be better asked to Eric Sills, but I think that's what they're saying, and they're not recommending it. They're saying that if you close the tube, then chances are the egg won't get fertilized. But I don't think it's necessarily to avoid extrauterine pregnancies, at least that I'm aware of, unless that's a new development. What else, folks? We're going on 23 minutes or so, 22 minutes. I don't want to bore people. I want to make it short and sweet, but as long as there's questions, I'll hang around. And I will stare at the green dot on my computer. Trying to think of anything else that I'm seeing or can think of. You're welcome. You're welcome, Annabelle. Any hoops to go through for type 2 diabetes before surgery? That's a good question. Obviously, if you're in good control, meaning your sugars aren't in the 300 or 400s, there's absolutely no restrictions on you having surgery. I think that, I've done a lot of surgery on women with diabetes, and, the only one that we were concerned about had a blood sugar that was around 400, but we got it down the day before her surgery so that she was fine. So I think as long as you get it down, or you have decent control from the beginning, it's something that you should be fine with. So, any more questions? And I also want to think through jumping through hoops. Insurance companies usually don't make people jump through hoops. If the doctor's telling you there's hoops that they have to jump through, there aren't. As long as you have pain and you have bleeding, those are the hoops you need to jump through. Secondarily, if they're telling you that you have to lose 20 pounds, blah, blah, blah. It's all blah, blah, blah. That's a doctor that doesn't want to help, and I would just get somebody that does. Yes, Carrie, we did. We did yours just fine. And now she's E-free. So, like I said, you know what? If you want these things out and they're causing you problems, then it's probably time to get them out. Or, maybe there's other things that are going on. Like a lot of women that I operate on do have scar tissue and endometriosis and other things, and that could be causing some of these problems as well. So it looks like some of y'all are leaving. Oh, the numbers just went back up again. Maybe we got some new people. Anybody new here? We're just asking questions about Essure removal. I'm going to text my son back to make sure he's still alive. Any more questions? Anybody going once? Going twice? I'll probably do another one of these in a couple of weeks. Again, my email address, if you have doctors, oh, hang on, we got a question. I am from Iowa, and I am a student working on my bachelor's. I'm going to Des Moines on Saturday, just so you know. I am staying in North Dallas for a few months for an internship, and I was wondering if you accept any Texas state insurance. Pretty much take everything. There's a couple of Obamacare type plans that I don't take, but otherwise I take everything. If you want to call tomorrow, 512-533-4141 and ask for Amber or Angela, and see if you can run the insurance by them. They can definitely let you know if we take it. My email address is stassone, so STASSONE MD PhD@gmail.com. If you want to give that email out to doctors, healthcare providers, and let them know that I have a course that I'm going to be signing people up for, where they're going to be able to learn how to do this correctly, from workup to post-op to I have videos of the procedures. It's just going to give them the whole shebang. And what I'm going to do is start linking those people to a website where you can go and put in your zip code and find a provider in your area instead of having to come out to Austin. Jerry Bailey's here. If any of you live in Idaho or close by, I think he's in Coeur d'Alene, Jerry Bailey is probably the best chiropractor in America. His wife might argue that, but she's pretty special in her own right. So Coeur d'Alene, I think it's up there by the Finger in Idaho. Beautiful country. And Jerry's a good guy, great chiropractor, Jerry Bailey. Check him out. What other questions you guys got today? Anything that I can answer for you before I go save my son from no tennis practice? Any of you guys? Kim Harlow just said, what's up? Kim is my medical assistant. She knows more about Essure than I do. She's the one, the blonde girl that rooms everybody when you guys come in. And she's a wealth of information too. So if you ever call the office and you can't get a hold of Amber, you can always talk to Kim. Like I said, my team, because we've done 250 of these, they're crackpot smart. They know exactly what they're doing. They can answer pretty much any question you have, especially regarding insurance and scheduling. So thanks, Christine. I really appreciate your comments. If you guys can share this video on the Essure pages, the subgroups, I would really appreciate it. Can the Essure be safely removed? What's your opinion on the claims that it causes problems? Well, I think it can be safely removed because I do it all the time. And I don't know what you mean by the claims that it causes problems. I think that there are problems for sure that we're seeing: pelvic pain, bleeding. You know, I do see women that have rashes, potential nickel allergy issues. So I definitely think there's some issues going on. Does every woman that has Essure have problems? No. I think, you know, I would have to guess, but I'm probably saying 25 to 30% of patients that have the coils in are having serious problems. Maybe some women don't recognize that they're having problems because it hasn't become public knowledge yet or well known yet. But I think that proper counseling is probably happening more and more about the potential risks and side effects, and doctors are being more educated because of the black box warnings that are now occurring on the product. And so more and more women know more about it and are investigating it a little bit more. Wow, the numbers actually went up. We now got more people live than we had in the beginning, so that's great. I guess the longer we're on, the more people are getting off of work. Running on about 30 minutes. Again, I don't want to bore people, so I'm probably going to sit here for a couple more minutes unless we get an onslaught of questions. Please help me get this video out and share it with whoever you want, with someone that might be considering getting it. Other pages, your subgroups for your states, the main Essure page. You can check out the Essure Removal website that I have, Essure Removal Tassone Method. I'm going to talk on that page specifically about salpingectomy. And if you want to invite your doctor to that page, there are a couple of doctors already on there because they've contacted me. It's a way for them to also learn about salpingectomy as well and how to do workups, and you can ask questions on there as well. I think I'll probably sign off for now unless somebody's got an immediate question so I can go get my son from his abandoned tennis practice. I really appreciate you guys tuning in. I love the questions. The nice thing about these questions is that this will become a data bank for other women. I'm eventually going to transcribe these questions into a PDF so that instead of listening for, I think the last session we did was an hour. This one's going to be around 35 minutes. Rather than having to watch everything, you can read the brochure or the PDF file that will have the answers. And so and we'll try to categorize those by question type as well. So that's it for now. I'm going to sign off, and I will see you guys in the future. Hopefully I'll see some of y'all soon.